Okay, so today we're at our Palmetto Bone and Joint Chapin office location. We're going to start today with some injections. We've got several hip injections as well as a knee injection for stem cells and gel. And then we'll be heading over to the office where we'll be evaluating patients for new problems as well as seeing patients follow up from surgery. And so excited to get the day started and see what we got in store. So let's get going. So what we could do is go ahead and get you scheduled for an injection in the back as well.
Okay.
Just can't do that today. They won't let you do both at the same time, but we could get you scheduled for an injection around where that nerve's getting pinched and just see if that wouldn't help calm that down.
Okay, good deal.
Does that sound like a good plan? And then that way too, we can kind of see how this shot does in relation to the other one, and hopefully that'll help.
Well, and hopefully I can have the surgery soon. I'd rather be safe. So are the back injections kind of similar to this? Is it the same?
They're very similar. They're done under X-ray.
Okay.
You know, they do numb them up pretty well, just because they're a little bit different. You know, this one is just kind of the stick, and
Right.
but those they'll put a little numbing medicine in and then kind of get it numbed up, and then they'll do it. So it's not usually too bad. The difference is they do ask that you have a driver for the spinal injections, just because you're injecting that numbing medicine around the nerve. If it numbs you up, then you could be kind of weak feeling driving home, and so yeah. This one you don't get that because we're not around the nerves or anything.
Right,
So.
right.
But clearly the hip is a problem. I mean, it's completely bone on bone, unfortunately. So it looks pretty rough. So I know it's hurting you. But
Well, I'm ready to have the surgery. I'm just going to get all those things.
I understand. I understand. All right, I'm just going to feel here on your hip, okay?
Okay.
X-ray. Okay, great. All right, it's going to be a stick here, okay? Here we go. Big stick. X-ray. Go live. Okay, great. All right, we're just going to put the medicine in and then we'll be done, okay? Okay, that's it.
Sorry.
No, you're good. Not too bad, was it?
No. Okay. Look.
I think I can't tell where I even stuck you. But I think that's it.
All right. You can throw that over. And go ahead and slide your pants.
All right, now take it easy today, okay?
Okay.
You know, if you did a lot of strenuous activity, it can make the shot less effective, so just kind of be easy today. Shot should kick in within a couple days, so hopefully by Saturday you should notice improvement in that.
Okay.
Yeah. And then we'll ask them, all right, on here, ask them to go ahead and get you scheduled for the back injection.
Okay.
And most of that pain is on that left side.
It's on my left, for
Okay.
sure, yeah.
Okay, so I'll put that on there so that they'll know to get you scheduled for that as well. Sound good?
Thank you very much.
I hope it helps.
Appreciate it.
You're welcome. You have a great day, okay?
You too.
Okay, so just did a hip injection. She's got pretty severe arthritis. You can see on the x-ray. I mean, there's just no cartilage left, completely bone on bone. So hopefully that should help her. She does have some back issues. We'll get her a shot for that, and hopefully that'll help as well. So we'll move on to the next one.
It's so nice to be cool. My air conditioner is going to get fixed today.
Oh, yay.
2 weeks it's been out.
Oh,
2 weeks.
that's miserable. At least it was
Not so high.
not as
We were
not as
in
bad.
concrete during the worst part of
Were
it.
you?
Yeah.
Well, that's good.
And so we came back, and that
You're good.
first night we were back it was bad, but and last night was a little touchy.
Yeah, it was a little warmer yesterday for sure.
They didn't come yesterday or the day before because it might rain. That surprised me.
What are you calling for rain yesterday?
Yesterday was nice, yeah.
I said, I'll put a tent over it.
Yeah, just fix it.
Well, at least you're getting it today.
This leg needs to be relaxed, doesn't it?
Yes.
Now, I bent that knee again.
Okay, you ready? I'm just gonna feel here on your hip, X-ray.
Oh.
Okay. All right, it's gonna be a stick here, okay? Here we go. X-ray. Again.
I know it doesn't hurt, but
No.
but my system doesn't know that it doesn't hurt.
Right. X-ray.
Sorry, I didn't have the order. It wasn't under the right.
Go live. Okay, great. All right, we're gonna put the medicine in and then we'll be done, okay?
Okay.
And then take it easy today for me, okay?
Oh, okay.
And then shot normally takes a couple days to kick in, so hopefully by the weekend you'll be feeling better with it.
Okay. I can't wait to see how it goes.
Yeah, I hope it does good. All right, I'm gonna get you a Band-Aid on there. Not too bad, was it?
Wasn't bad at all. I couldn't have told you you'd done it.
Well, good. All righty.
Can't complain about that, right?
Jamie, go ahead and slide those pants up.
Well, that's this one.
Help.
You've done it before.
There we go.
Wait.
Yep, take a second.
Dizzy.
Yep, take a second.
Thank you.
I won't let you forget that.
Okay.
Feel okay?
Yeah,
All right, well, I hope it helps.
I do too.
Have a great day, okay?
have a great week.
Okay.
That's how I found you, Doc.
Is that right?
Yes, sir.
There you go.
Looked up chicken wing and there he was.
There I was. I've got a few things on there.
Huh. So you can text where you find your own spot
Correct.
instead of just poking it in the hole.
That's it. That way we're more precise to make sure we're getting those stem cells and that gel
Good deal, yeah.
exactly where we need them.
Because when I've had the cortisone shots, they don't do that. They
Yeah.
stick it in. Only one time did he hit right.
Is that right?
The rest of the time, nothing.
Oh. Well, we're going to hit right today.
I hope so. I hate to see you from malpractice and do that on YouTube.
That's right.
Oh, golly.
All right, so this is our stem cell.
Holy cow. That'll go all the way up to my elbow.
Yeah, that's just to draw it up out of the
Oh, okay.
tube, so you're safe there. And then I'll need one more of those. Yep, that one. All right, you ready?
Are you ready?
You already
I've
prepped.
been laying here for
You already
a while,
prepped.
Doc.
All right, so I'm gonna feel here on the knee. X-ray. don't know what they've got. Okay. All right, will you spray for me right there? We're gonna put a little cold spray on there, okay? That's gonna help numb it up a little bit. That's great. All right, it's gonna be a stick here. X-ray. Go live. Again. Go live. There we go. Alright, we're going to put our stem cells in first.
But that's what you just did.
The first one was contrast to verify that we were right where we needed to be.
Okay. Doc, you gotta let me know what's going on.
Yeah. So that contrast just confirms where we are.
Inquiring minds want to know.
Absolutely. And then stem cells are in. Now we're going to put the gel in, okay?
I noticed you're putting it in from the left side, but it's the inside of the knee that doesn't have curvature. Does that matter?
No, because it's inside the sac that's in there.
It's supposed to be.
And so it's basically gonna work its way all over the place. So it's just easier to get in typically from the lateral side, the outside. It can hurt a little bit more from the inside. So that's why we kind of shoot it over to that way, but it'll work its way all over, so.
I'm just curious.
Yes, sir. All right, well, we're all done.
Super duper.
Bend those knees up, I'll take this
Now, if I
cushion
can bend
out.
more,
You should be able to.
is that knee gonna get low on me? Watch the idiot.
No.
Thanks,
All
Doc.
right, my friend. Well, I hope that helps, okay?
You too.
You take care. Okay. So did stem cell injections as well as gel to help lubricate the knee. The stem cells are trying to help grow new cartilage in the knee, so he's trying to avoid knee replacement or at least delay it as long as he can. So this is a good option for people who are trying to look to do that. So that's it for their injections this morning. So we're going to head on over to the office side and get started seeing patients there. So this patient's got knee arthritis. You know, it doesn't appear to be completely bone on bone, but there's a little space, but it's pretty close. And then he ended up having an MRI, which showed complex tear of the medial meniscus, which is a cartilage cushion inside the knee. But he's also unfortunately got pretty significant full thickness cartilage loss on that inside part of the knee as well as in behind the kneecap. So really the only option to fix that would be a knee replacement. So we'll go talk to him and see how he's doing. Hello, how are you, sir?
Good to see you.
Good to see you. Well, how are things?
Better since I got the shot.
The shot helped?
It did.
Good. Is it tolerable where it is right now?
It is.
Okay, good.
Yeah, Victoria did a good job on it.
Good, good. You know, looking at your x-rays and then that MRI that you had done, you know, on the plain x-rays, it's like, well, it's not completely bone on bone, but on that MRI, man, you've got the tear of the meniscus, which is that cartilage cushion that's in there, so that's not helping matters. But then you've got areas where the cartilage is completely gone. And so, you know, ultimately, you know, if it keeps bothering you, you're just like, what can we do to fix it? You know, knee replacement would be the only option long term. If the injections are working, I mean, you can continue to do those injections, you know, as long as you feel like they're helpful for you.
Is there any need to fix the meniscus?
So the problem with that is because you've lost all that cartilage, typically what'll happen is if you go in and scope the knee and you kind of, because what you have to do is to breed out that torn part of the meniscus, so then that leaves you with less cartilage, although that cartilage that's there that's torn isn't healthy, so it's not helping matters, but then you have less cushion all around, and so typically people get worse after doing that. And so when you're in that circumstance, I usually tell people you're better off to not do the scope, because usually it'll make you worse and it'll push you to having to have a knee replacement a lot quicker. Okay. So as long as it's manageable with the injections, then I wouldn't do that.
You don't want to get so bad.
Correct, yeah. Now, you know, I wouldn't recommend just suffering with it, you know, letting it get so bad to where you're just like miserable. But if it starts bothering you on a regular basis, don't let it get it too bad, but then that would be the time to consider replacement on it.
Are there different options for the knee replacement?
So just from an approach standpoint, the way that I do my knee replacements is different than most people. So
Okay.
the traditional technique that most people use is they make the incision down the center of the knee,
Right.
and when they do that, they have to cut into the tendon and muscle. But then you're trying to do your therapy afterwards and bend it and move it, but the tendon's been cut, so it hurts and it's hard to get the mobility back. So that's what traditionally makes it take so long to get over. So the technique that I use is I come from the inside part of the knee, so we avoid cutting into that muscle and tendon altogether. So that does help make the recovery quicker return of mobility and muscle function, and then usually less pain. It's still a knee replacement, so the components themselves are the same, but it's just the approach of how we get in there, not cutting that tendon and muscle is what makes the big difference on it. So
My sister had a knee replacement, sister-in-law had a knee replacement, and I think they told her it'd be like a full year.
yeah. Yeah.
And I think it was the traditional.
Traditional, yeah.
Right.
So there's very few people currently, just because the guy that developed the technique, you have to go and train with him in order to be able to do it. And so he's training people all the time, but it's just there's very few people out that are currently doing it. But that, if it comes down to it, that's definitely made a huge difference in the recovery for people. The replacement that I use, they do claim last over 30 years, so it has, the newer ones have really good longevity to it. And so, if it got to a point where it's just bothering you all the time, that, like I said, the shots aren't working anymore, because that's what eventually will happen is the shots get less and less effective.
I'm sure it's coming over time.
Yeah, but as long as it's tolerable right now, we can just kind of watch it. So was it just cortisone that she did? Did she talk to you about gel or anything like that?
She said you would need insurance approval to do gel, so that's why we started with cortisone.
Yeah. And they haven't done that. So what we could do, I think the gel is probably a good idea to consider doing.
Okay.
And so we could go ahead and get the authorization with the insurance and have you come back. I tell people it's kind of like keeping the oil in your car. Things are going to run smoother. It's not going to break down. So hopefully by keeping that gel in there, same thing. It's going to keep it lubricated so it slows the progression of arthritis and then hopefully makes it last longer. And then I just tell people, we do the gel every 6 months. Even if it gets to a point where I'm feeling pretty good with it, still do the gel. That way we keep it lubricated, and then that hopefully will allow it to last a lot longer.
Let's do that. That'd
Yeah.
be great.
So that'll be the plan. So what we'll do is I'll have them get that authorization, and then they'll get you an appointment to come back so we can do that.
Thank you.
Sound good?
Yes, sir.
Any other questions? That's it.
I like that you have a new approach to the knee surgery too. So
Yeah.
you won't have the year recovery.
Absolutely.
That's what I was dreading. I said, I don't want to be hobbling around for a year.
Yeah, absolutely. No, it's made a huge difference. Yeah, I don't do the
What's
traditional.
the recovery for the new way?
So typically, you're up and walking right away afterwards, so you can put weight on it, you can move it. Most people will use a walker maybe for a week, and then a cane for a week or two after that. So 2 or 3 weeks, you're getting around pretty good. But there's still a fair amount of soreness and swelling that's there. That really takes about 3 months for most of that to fade away. By 6 weeks, though, most people are back starting to do most activities they want to do. You probably between 3 and 6 months for kind of all the little soreness and things to kind of work their way out. But yeah, really by 3 months, you're cruising pretty
Great.
good.
That's less than half the time.
Yeah. So.
Okay, I like that.
All right. Yeah, no problem. All right, well, come on up here with me and we'll go talk to them up front and have them get that gel authorization for you, okay? All right, she'll get that for you. Good to see you.
Thank you,
Have
sir.
a great day, okay?
Turn your toes toward each other. Got you hanging off the table. We could have slid you back a little bit.
All good.
Just this.
I'm Brian Adams. My sweet wife Julie.
So Brian, how do you feel?
I'm really encouraged. Before the surgery, my hip had deteriorated enough that I was essentially walking with a cane. The first 2 or 3 weeks after the surgery was not a joke. I think I had a false expectation of what rehab would look like, but did the therapy and followed the rules with using walkers as I needed to, and then graduated to a cane. So after about 3 or 4 weeks, I felt like I really was on the upswing for sure. I have been without a cane now and without pain meds for a couple of weeks, and I think I'm walking better than I have in years. So I'm very encouraged.
And do you think the first couple days of recovery was something to be expected, or?
So when you do surgery, you talk to people who've had those surgeries, but it's been a little while, and I think they remember the great results of the hip replacement, for instance. They don't remember maybe how hard it was for the first few days, like, oh, it's a piece of cake. And so that was kind of my expectation. It wasn't because the office here had set some false expectation. But yeah, so I'm thinking, after 3 or 4 days, I'll probably be up and walking around doing fine, and that wasn't the case. I think it was just a false expectation on my part. But after talking to the doctor at my 2-week follow-up and him assuring me, or actually it was Victoria, said, you're right on schedule. That I wasn't worried about it, but that was certainly affirming. And so it's good. Folks at church who see me, who've watched me kind of limp around, are like, yeah, you're walking a lot better. And so that's always encouraging too. Well, Julie and I love to travel. And so, probably just travel and being able to walk and function without bringing a cane or gimping around. I think that's it. Just being mobile makes a big difference in everything in life. And so we're very thankful for that.
He's here for follow-up of his left total hip. He's about 6 weeks out today. He is having some knee pain on that side, so we x-rayed his knee as well, just to check that out. Got a little mild arthritis in the left knee, but nothing major. Some of that can be referred pain still from the hip that's giving him some trouble, but his hip looks great. So we'll go in and see how he's doing. Hey!
Good morning.
Good morning.
I'm sorry. Good to see you again.
Good to see you. Good morning. How are we coming along?
We're doing great.
Doing good?
Yeah.
Making good progress?
I really think so.
Excellent.
You tell me if you had a different opinion, but it's way better than it was before the surgery.
Excellent.
The only sensations of pain I really sense is if I stand up and I rotate so that this happens, or if I'm standing and I try to push my belly forward so that I'm bending that joint back. It's not unbearable, but that's where I'm like, ooh, I can really feel that.
Gotcha.
Otherwise, I'm really not feeling anything pain-wise.
Good. Excellent.
So yeah.
That's a good thing.
And you can advise me, because we're not doing PT any further.
Okay.
Self-pay, just you're trying to be reasonable there, but
Sure.
I don't know how much to push that. Do I just kind of go till you feel it and then just kind of just work that out?
That's right.
And same thing here, just till it'll make gains over time.
That's correct.
Okay.
Yep. You don't want to push it to where it's like so painful, but yeah, I mean, a little bit of discomfort's okay to stretch it, and so it's just kind of, things are going to be tight, there's still swelling that's there.
Okay.
So as you get to those extremes of mobility where you're, haven't really stretched it before, you're going to be like, that's a little uncomfortable. It's okay to kind of do that, but yeah, if it gets painful, then I just wouldn't push it. And then, over time, that's just going to keep getting better and better as you do it. So x-rays look great. So I mean, everything with the, the replacement itself looks good. Knee giving you some issues?
Yeah,
or?
so the knee's been an issue for several years. It really only shows up when I'm trying to walk up steps. And even when she was doing the x-ray and she's like, squat,
right?
I really feel, it's right on the front of the knee. It's like right on that kneecap.
Yeah.
Is where I'm really feeling it. So I'm one-stepping steps just because, not because of the hip.
Right.
Just because this leg, that knee just cannot step up and get me up.
Gotcha.
And so I don't know what's up there. I don't know if PT is an option there or...
Yeah, so, sometimes, because it sounds like it's more like patellofemoral, so the kneecap probably have some arthritis on the back of that kneecap. Now, x-ray wise, there's some arthritis there, but it's not bad. Good. So it's definitely not bone on bone where you're like, oh,
good.
You need a knee replacement.
That's great news.
So hopefully that will hold on and last you, quite a while still. Right. But you probably do have some arthritis on the back of the kneecap. So going up and down steps, that's putting more strain on that area. And getting up out of a chair, same kind of thing.
Absolutely.
A lot of times strengthening that quad muscle, because that's what provides the stability for going up and down stairs, getting up out of a chair. And you're going to have weakness in that quad just from the hip surgery, and then dealing with the arthritis that you've been dealing with. So we probably have some underlying weaknesses there. But over time, hopefully that would continue to, as you work it, that'll continue to get stronger, and that may help make the knee better.
Okay.
Now, say the knee continues to bother you, it's like, well, could we do anything else for it? You could do some gel injections in the knee to try to help lubricate lubricate that area so it's not so much of the arthritis rubbing. That might help some, but I think the strength is probably the biggest benefit.
I may need to go find a therapist to advise me, but even to do this, I mean, because it's doing the same action, it's really putting pressure right there, just like stepping up. So, if I were to be on a machine and try to do a weight here, I'm like, man, I don't do that.
So if you felt like leg extensions, where you're in the machine and you're doing those things like that, if you're like, that's going to aggravate me a lot, we want to stay away from things that are going to aggravate it. Now, the one thing you can do that's going to help strengthen that without having to bend the knee is doing just straight leg raises. Okay. And so, you can do just body weight at first, where you're just kind of raising the leg like that. Yeah, and it's when you come up, just really try to squeeze that quad muscle, and then you can always add ankle weights to it. So if you're like, I want to work on building, getting higher strength, like this is too easy for me, then you can get some 1-3 pound ankle weights or some 5 pounds.
That's great.
And then you can kind of just work that up as time goes.
I'll work on that. If I were to do gel, what's your crystal ball tell you? Would that perhaps really give me some relief given where that focal is?
Potentially. I think the strength is your biggest thing. So I think work on that first, and then if it's still not going away, then maybe we try the gel.
You have any idea how expensive gel is? We're self-pay.
Yeah, I mean, typically it's about $900, I think. So
if that gave me relief, let me do this, but if this doesn't really get me there for $1,000, I'd be happy to get some relief.
Yeah, if I had to say, like, we're in Vegas and you're like, you got to bet on, on what I do, it's going to give you the most chance of success. I mean, the therapy is probably going to, getting that strength in that quad is probably going to make a big difference with that.
All right, I'll do that. If I did do the gel, how long does that tend to last?
So usually about 6 months. And so, and then it would be something you'd want to do every 6 months. But I've had some people get gel and they feel benefit for it for like over a year or more. And so it can last longer. But after about 6 months, the body's going to have started to break it down, and so.
That's repeatable, or is it like those cortisone type injections where it works pretty good the first time, it goes less, and by the third or fourth time you're really not getting much benefit?
No, you can repeatable, So I've had some people you get gel and they've been getting it for 5-8 years or more. So.
Good, thank you.
Yeah, so not too bad on the arthritis in the knee. So I'm hoping strengthening those muscles will continue to help. Incision all healed up okay?
It is.
Can I take a peek at it?
Absolutely.
And you wanted to ask about MRI?
Yeah, so the metal in this joint, can I get MRIs in the future?
You sure can. Oh, that's healed up nice. Beautiful.
Kind of sweat on it, but.
Yeah, that's healed up great. So real happy with that. So the metal that's in there, I mean, will not cause any issues with an MRI, so you're free to have that. Typically MRI, the issues are like mechanical devices, so like pacemakers, stimulators, things like that, although the newer technology for a lot of those things, you can have MRIs with those now too. So, but these, joint replacement implants, no problems with MRIs. You will set off a metal detector, so if you go through a metal detector at the airport or something like that, you're going to set it off usually. Not always. I've had some patients say they didn't, but most people it does. And so we can give you a little card that says you got it. Perfect. Yep. So the card you can show them. They're going to still pat you down and give you the full search down, but at least you got that kind of show them. So, but that's kind of the only thing that should limit you is just the metal detector.
All right.
But yeah, I think you're doing great.
Good.
So, any other questions?
You prescribed me Ibulitone or something like that?
Yep.
Before the surgery.
Yep.
So after I got off of the blood thinner, I started that back just because I'm in my 50s and I think it helps.
Yep.
So I'm taking that and Tylenol, and I'm probably going to just continue to do that. It's just a lifestyle unless you're like, look, you don't want to do that more than a month or two or type thing.
Right.
So I want you to be aware of that unless you're like, look, you don't need to do that.
No, I think that's fine.
What was my other question? You mentioned the MRI. Yep, that was it. The knee x-ray, the MRI, and then just describe my pain points when I twist out.
Yep.
I think those are all the questions I have.
All right. Well, I'm proud of you.
Thank you.
So, normally I would check you back in a couple months just to make sure everything's good. Do you want to make an appointment, or you're doing really well, or do you want to just call me at this point if there's any issues?
If you think I'm fine, I think I'm fine.
Okay.
Unless something strange comes up.
Yeah, obviously if there's any problems, just call me, come on back, let me recheck it. But yeah, hopefully what you'll notice is those little things that you notice when you kind of stretch it certain ways, that just kind of slowly just keeps fading away. And
We're doing that. We used to walk a couple miles every morning. I'm back into, but I'm working my way up, so we're about a mile and a half now. But I feel like that's helping regain some stamina and strength after being laid up for a few weeks.
Perfect.
I'll have him running soon, don't worry.
Uh-oh, you're in trouble.
A half marathon is in his future, even though he doesn't.
Yeah?
As a cheerleader for her.
Oh no, you're gonna do it. If you do it, I'll do it with you.
She might. She's like, I really
You,
do want to do
baby,
one.
not me.
Oh, he's talking about you.
No, I'm talking about you.
You too.
I'm talking about you.
I've already done a half marathon.
Yeah, we'll talk.
I might hold you to that.
Yeah, I'll do it with him if he wants to do it. Get you out there.
We'll talk, yeah.
He's like, this is not helping me. That's funny.
I might hear it when I get home.
All right.
Good stuff.
Well, you got my number, so you let me know if you decide you want to do it. I'll be there with you. Oh yeah, you're
And we've been
welcome.
watching a few of your shows.
Have you?
Including one that I was in. Like, what?
I know.
That's pretty impressive.
Yeah.
And your airplane and your that was great.
Well, good.
So it's nice
Well,
to
good.
get to know that.
Yeah, absolutely.
Thank you.
Absolutely.
God's blessings on you.
You too. I'm proud of
Perhaps
you.
we'll encounter again in the future.
Yeah,
I'll be
hopefully
working on
so,
this, and
but-
if I need help.
Yeah, we'll see you in that half marathon.
We might want to set up a future appointment. Julie's got a toe that catches. Do you do feet?
So I tip it. What's going on with it?
Well, it's anytime I'm not wearing open-toed shoes, I can feel that it's kind of yumpy. But
Yeah, so foot and ankle stuff I don't typically do a lot of, and so I usually send people to Carly Richards, who's the podiatrist down next to the urgent care in Chapin. She's in the Lexington Medical Center office that's there. She's really good.
Carly.
Carly Richards.
Okay. Yeah.
Yeah,
Great.
so
Thank
it's Lexington Podiatry. I think she may be the only one, but I know she's the only one that's there in Chapin.
Okay.
But that's mainly where she is. But
Very
she's
good.
really good though. So that's where I usually send people.
Excellent.
Okay.
All right. Thank you very much.
All right, well, if you give that to them up front, they'll get you checked out.
We
You
will.
call me if you need me, okay?
I will. Thank
All
you so
right.
much.
Thank you so much.
You're so welcome. Y'all have a great day, okay?
well,
All right, so this guy's 6 weeks, status post left, or right total knee. Correct?
yes.
Yeah. X-rays look great. Hello, hello.
Hey,
How are you, sir?
good. How are you?
I'm doing good. How we coming along?
Pretty good.
Making progress?
Yeah.
Good, excellent.
Poster child.
You're the poster child? Good. It's looking great, man. That incision's fading away. I think once
Yeah.
that thing's healed, you're going to have a hard...
Did you do that? Or
So Victoria probably did most of it. I usually will help a little bit, but she does the final closure on the
Good
outside.
job.
She does.
He needs to be a plastic. Still working on that.
Yeah, strength is what takes the longest. I mean, so that takes several months just to get all that strength back. So I'd encourage you, keep working with therapy, doing those exercises. Even when they turn you loose, from the therapy, just keep doing them on your own. But I'm proud of you. I mean, I think you're making great progress. Your mobility's excellent. The knee itself's looking good. Your x-rays look excellent. So,
Well, they did.
yeah,
Okay.
so I couldn't be more proud of you.
I didn't screw it up.
No, you've done great. You've done great.
Now we got to do the left one.
Are we scheduled for that yet, or when?
January.
In January, okay.
Don't let them reschedule.
No, we'll make sure. Yeah, so we'll get, that'll give this one a little bit longer to continue to get stronger. But yeah, I mean, you would probably
Will the swelling go down?
It does, yeah. Normally it takes for most of the swelling,
It's hard as a rock in here.
yeah. For most of the swelling, it really takes about 3 months for most of that to fade away. So we're about halfway there, but that should continue to go down. But for 6 weeks though, I mean, your swelling's not bad at all. So
I've been working hard, doing what they tell me.
I can tell it's paid off. So, well, what I'll probably do is check you back in a couple months, make sure that one's still doing good, and make sure we don't have any issues before this one. So,
Okay.
Does that sound okay?
Sounds okay.
Any other questions?
No, I don't think so. I think I'm doing everything I'm supposed to be doing.
Yeah, I'm happy with the progress. So, yeah, you're doing it. You're doing everything perfectly. So,
So, well, I work out at Crooked Creek.
Oh,
too,
nice.
So
that helps a lot too.
Yeah.
For sure.
So he said I could go to twice a week, but do front and then work the front part and then the back part.
Yep.
Alternate. So
Good.
and I've been walking mile a day, 5 days a week, and
Great.
4 to 8 miles on the bike.
Yeah, that's great. That's really good. Yeah, you're doing great. So keep it up.
Thank you.
I'm proud of you.
Appreciate it.
You are a poster child for sure. All right, well, if you give them that up front, they'll get you that appointment for a couple months just so we can check back, okay?
Okay,
I'm
man.
proud of you. Have a great day, okay?
You too.
Thank you. All right, so 6 weeks after a left hip injection.
Yes.
Okay, perfect.
Yes, sir.
Hey, how are you?
Okay, you are such a busy man.
They keep me busy.
Oh, yes, they do. And that's good, because we all enjoy you.
Well, how did the shot do? It did good?
Wonderful.
Excellent.
Yeah, it really
Is it still working?
Yes,
Okay.
it is still working, but I'd kind of like to make another
Yeah.
appointment, in the near future.
Sure.
Because as it wears off.
Right. You don't want to let it get too bad.
Uh-huh.
Yeah.
And I was asking her, as long as this is working, we don't need to look at any further.
Yeah, I think if this is doing pretty well, yeah, we can definitely continue to do the injections. If they get to where they get less effective, then we can always find you another plan.
Okay, and then of course suggestions. My main objective is to stay mobile. Since I just turned 79.
Right.
Any further suggestions as to meeting that objective?
Just like, exercise, getting out walking, things like that, to just keep the muscles strong. So, that's going to keep you going for sure. From an arthritis standpoint and the joints, I am a believer in like supplements. So like glucosamine, chondroitin, that's a great supplement to consider taking.
Okay, I don't take either of those.
Yeah, so that's a good one. I mean, we have our own supplements here if you wanted to look at those.
Okay.
Our advanced joint has several different things in it, but it's a really good one to really just help. I take it every day. The hope is that it just slows the progression of the arthritis that's there. So I think that's a reasonable thing to take. You could take turmeric, which is a natural anti-inflammatory, but the glucosamine chondroitin is the main one.
Okay. Well, we get the next appointment, because I know you're busy.
Yep. Do you want to do it in like a month or 2 months, or when would
2 months?
2 months?
Okay, August.
All right. Well, what we'll do is I'll have them make you the appointment for the hip injection in about 2 months, and then we'll kind of go from there.
Okay, thank you.
Sound
very
good?
much. I appreciate it. Thank you.
You're welcome. I'm glad it did so well for you.
Oh yeah, it really helps.
Good.
It's amazing.
All right. Well, if you give this to them up front, they will get you that scheduled. Okay.
Okay, thank you so much.
You're welcome.
Okay.
You have a great day. It's good to see you.
Good start.
So this lady's got bilateral knee pain. She's got pretty severe arthritis in both of her knees. So you can see on the inside part how there's just no space left, completely bone on bone. Bone's really sclerotic. You can see how white it is just from the increased density in the bone from the two bones grinding together. And then both knees are bowed slightly just from how worn it is on the inside. So definitely pretty severe arthritis. All right, so let's go see how she's doing. Hello, hey.
How are you?
I'm doing good. How are y'all? Good to see you. A lot of x-rays. Oh. Well, those knees giving you trouble?
And I loved the article in the book.
You did? No, well, thank you. Thank you. Is one knee worse than the other?
Yeah, this one.
The left one? Yeah, I think on the...
I've had an awful time walking last week already.
I'm sorry. And we've injected them before, haven't we? Have you ever had injections in the knees?
Yeah.
Yeah, it's been a while though. When was the last one?
I think it was Dr. Davis did it. What you mean for the gel?
The gel or cortisone?
Cortisone?
Yeah, she hasn't had the gel. Dr. Davis said she hasn't had the gel.
Okay.
So that's what he was suggesting yesterday when we were here.
Just trying that.
Yeah, to try the
Walking.
gel.
I didn't think I'd be able to.
But the last cortisone was a pretty long time ago as well, wasn't it?
Yeah.
Okay. Can I peek at this one?
Yeah, this one isn't nearly as bad.
Yeah. All right.
Shoes, cool.
Thanks. Yeah, they're super comfortable. These are the x-rays on both of your knees.
Yeah.
So you know, what we're typically looking at is the amount of space between the two bones, and you can see, I mean, on both of them, they're just completely bone on bone. And then because of that, you know, how worn they are on the inside, the knees are also starting to bow. This one's a lot worse than the right one, but they're both bad. So, you know, ultimately, if you said, okay, well, what can we do to fix it? You know, knee replacement would be the only option to fix it long term. Now, we could definitely try the injections to see how they do. So it's been a while since you've had the cortisone, so we could do that today. And then if you wanted, we could do the gel as well. And just do both together. The nice thing about that is you're going to get quick relief from the cortisone, so within a couple of days, hopefully you're going to feel an improvement in it. And then the gel takes a lot longer to take effect, so normally about 4 to 6 weeks to get the full benefit from the gel. But that way, the cortisone is going to hopefully get you some relief, but then the gel will start to kick in and then get longer relief with the gel.
Now, did you see packets with fluid in it? Because that's what they told me from the first x-ray.
Yeah, it's hard to see. I mean, you can tell that there's definitely inflammation in fluid, but you know, to say like, you know, there's localized pockets of fluid, that's harder to tell on a plain x-ray. You know, that would be something you need more like an MRI. So like sometimes people will have a Baker cyst in the back of the knee. Really hard to see that on a plain x-ray, and that takes more of like an MRI. But
I trust you.
But I wouldn't be surprised if you didn't have that as bad as they are. So.
Yeah. They really hurt.
Yep.
Yesterday I could have cried all day.
I'm sorry. Well, let's see if we can't get you a little relief here, okay? So what I'm going to do is she's going to grab our gel for us. I'm going to draw these cortisones up, okay?
Yeah, I took that magazine home so I could read the whole article.
Did you? They did a pretty good job, I felt like.
Wow, very good, wonderful. Very impressive as well, Doctor.
Well, thank you. Sorry, had you blocked out. All right, you ready?
Yeah. As ready as I'll ever be.
As you're gonna be. I'm gonna start with this bad one over here.
And this is part of my knee, hey?
So that's the fibula head, and so I think because this knee is getting so bowed, you know, it's kicking that tibia out, and so the fibula head is becoming more prominent.
Same on this one?
Yeah, same on this one over here. And so...
They're both no good, period, right?
they're both pretty bad, so I know they're hurting you.
Yeah.
Now, which one is that, Doctor?
This will be the cortisone first.
Okay.
Now we're only going to stick you once though, so I'm just going to change out the needle or the syringe, and so try to limit how many times I have to stick you. All right, real cold spray, help numb the skin.
So numb it?
Yeah, it helps numb it. Yes, ma'am. It's going to be a stick here. Doing okay.
Now, doctor, with all the problems I have with my back, am I going to be able to get any surgery on my knees?
I mean, you still could. I mean, it's going to make the recovery a little bit harder for you, for sure. But you could still do it. It's just, you know, you probably need to go to rehab for a little while.
Oh, I believe you. You know, I trust you completely.
Yeah, but you can still do it. But yeah, with the back issues, it's just going to make it.
She's been going to physical therapy.
Perfect.
But they said there was nothing they could do for her.
Yeah. Well, part of it, yeah, I mean, she's limited so much by the knees and the back, and so, but, you know, getting the knees corrected would help her, I think, a lot.
I think so.
Because the bowing that's there, that's going to continue to put strain on your back as well. So, I mean, that's just making the back worse at the same time.
Yeah, now for me to get up, is that because of my knees or my back or a combination?
Probably a combination. Yeah. Definitely the knees.
Well, therapy didn't want me anymore. They said they couldn't help me, they were too tight inside.
You're right.
Whatever they tried didn't work.
Didn't work, yeah. So I mean, maybe at some point, I mean, you'd want to consider the replacement on it, and just, it may take a little longer to get over, and go to rehab for a little while. But I mean, it's better than being miserable in the pain that you're in.
She's been in pain for a long,
Well, I trust you
time.
in your judgment.
Yes, ma'am. Oh, well, I'd do anything for you to help you.
I know, Doctor.
All right, well, let's get this other one. We don't want to forget it.
No.
If you're nasty, you're gonna get a needle like that.
I've had him before.
Oh, goodness.
You're good at that, Jerry. I'd kill myself if I tried.
All right, so alcohol. And then we're going to do that cold spray again, okay? So real cold. All right, it's going to be a stick here. Doing okay? Doing okay?
Yeah.
Okay, we're done.
All done?
That's both of them, yep. Now take it easy today for me, okay?
Mm-hmm. Is your daughter working today?
No, she goes back to school this weekend, so
So she better have time.
she wanted, yeah. She took this week off.
She's pretty.
Thank you.
She looks like you.
Oh, well,
Her nose or
she's-
something looks like mine.
She's she's much better looking than I am, so.
Oh, I don't know about that. You're pretty good looking.
Well, thank you.
Now, we've got an appointment with Dr. Sakla on the 21st.
For her back?
I was just gonna ask, I'm not really sure what she's being seen for on that day, because Davis said to see him.
Yeah, he's our new basically guy that does all the back injections and things like that.
Gotcha.
And he does a lot of different things, and so he's got a lot of options that could help decrease the pain in that. So he's really good. People love him, and
he is nice too.
But technically he does a really good job.
Good.
So I think that's worth getting him to check it out and see what he can do to
Yes,
help.
okay, good.
Sound good?
All right.
And then.
Yep.
And then the knees, I mean, we can make you an appointment for a few months to come back and just see how these have done, and we could always redo the cortisone if we need to.
Okay.
The gel, we can do every 6 months if we needed. And then, if you want to think about, knee replacement, just kind of think about it, and you can let me know if you decide you want to do something like that, and we can talk more about
She's
it.
also been getting the Prolia.
Perfect.
Which, actually, I thought today you were supposed to get the Prolia.
Yeah, they had you down just for the knee.
It was in June.
The Prolia was? Oh, okay, yeah. So she wouldn't be due until December 6th, yeah.
Okay.
Yeah, Prolia should be in December.
Okay.
Because we did it in June. Sound good?
All right.
All that's about me, huh?
This is all about you. And then you want to do 2 months just to see where we are and how they're
Yeah,
doing?
let's do that.
Okay. If these did really great, like I said, we can keep doing them, but say we do this and you get like a month's worth out of it and then you're back miserable again, may want to consider looking at a replacement on it.
Okay.
Okay?
All right.
All right, sweetheart.
Trust you, Doctor.
If you give that to them, they'll get you that appointment, okay? I hope it helps.
Okay. Thank you very much.
You're so welcome. It's so good to see y'all. Y'all have a great day, okay? Bone arthritis-wise. So you can see just no cartilage left on the inside part of the knee. So, all right, we'll go talk to them, see how they're doing. Hello, hello. I'm good. How are y'all?
Good. How are you?
Good. Good to see you. What's going on?
Well, we came to have x-rays to see about the other knee.
See about the other knee.
If you think that's what I need to do.
What's going on with the cast?
Ankle surgery.
What? You have reconstruction.
Yeah.
Pretty much.
How long are you going to be in that?
Well, I'll go back and see him Tuesday.
Tuesday. So
Hopefully
hopefully
I'll
get it off then. I'm sure. That's no fun for sure.
And this is a testament to tell you how good your
Oh, what happened
is.
there? Did you fall?
I took a little fall this morning.
Today?
Looked
Oh.
out on the chair leg. And
Oh.
So,
Poor thing. I'm sorry. X-ray on it looked good, so I mean, no damage done, fortunately. Can I peek at this one?
yeah.
All right, bend for me, and then back out straight. And when you get pain in this one, is it more to the inside in here, or just kind of all over? Or?
Oh, I don't have a lot of pain.
Okay.
But when I bend over to get something, I can feel it rubbing.
Uh-huh.
But when there is anything, I guess it's right.
It's right in there on the inside. Have you been getting any injections or anything? Or?
I was,
Uh-huh.
and they didn't seem to work.
They didn't help at all? Gotcha. All right. Well, these are the x-rays on both of your knees. Okay, so here's your replacement on your right. Everything looks great there, great alignment, so no issues. Here's your left knee. If we look at the inside part there, there's just no space, and so it is completely bone on bone. So you've got reason for it to be giving you trouble for sure. So when you're trying to get up and down or bend over, like you notice that kind of grinding, that's why.
That's it.
Yeah.
Okay.
So obviously once it gets to that point, if you said, okay, well, what can we do to fix it? Knee replacement would be the only option, very similar to, how the other one was done. But that's what it would ultimately take. So I don't know if you're to that point where you want to go ahead and schedule that, or if you want to.
I've started.
You've already?
This
Okay.
will be the third one.
Gotcha.
1, 2, 3.
Gotcha.
So,
hopefully that'll be the end of it, right?
Yes, I'm gonna get it done, so.
Yeah, my schedule's, a few months out, but that's good because that gives you time to continue to rehab and recover from that, because that's going to take you a few more months to get over
it in January.
Okay. Well, do you want to go ahead and talk to the scheduler and see about getting it scheduled? Any questions about anything? I know you've been through it before, so you know what to expect.
No, I'm tickled to death with it.
Okay, good.
You had me on the golf course in 5 weeks.
Okay, well that's great. That's what we wanted to get you back out there. 5 weeks is a little quicker than most, but normally 6 is reasonable. Yeah. But you were gung ho. Go back out there and get at it. I like it. Now, do we do that one at the hospital?
Yeah.
Okay, so we'll plan on doing the same. Does that sound good?
Sounds good.
All right. Well, come on up this way with me. Get your knee scooter here.
Yep. Got to hate this real well.
I know. Well, hopefully you'll get that cast off soon. I know you'll be happy on that. Yep. All right, right up this way, okay? All right, so 60-year-old gentleman with pretty severe arthritis, right knee, completely bone on the inside. So definitely reason to be hurting. So we'll go talk to him. Hello. How are y'all?
Alrighty, how you doing?
Good. Good to see you.
You too. How are you?
Doing good.
One of the past patients.
Yeah, exactly. What's going on?
Well, y'all got the x-rays.
Yep.
Come in and seen
Dr. Milner.
Yep. You're the one I trust.
Okay.
I don't care. I don't know him.
Sure.
I ain't got no animosity or anything.
Yep.
I know you.
Sure.
And I know your results. But for the last several months, it feels like a splinter is going through here.
Right.
And the knee wants to bend backwards.
Does it?
Yeah.
Okay.
You can feel this. There's like a bone there, but this is smooth.
Yeah.
I don't know if it's like two rough edges popping on each other.
Can I take a peek at it? Will that pants leg come up?
Yeah.
So part of that is the tibial tubercle, so it's where the patellar tendon comes and inserts, and so you probably have some bone spurs around it, just from the arthritis that's in there. So
if you're laying there asleep and try to stretch,
right,
it'll darn sure wake you up real quick.
Gotcha.
And,
all right. Well, did he show you your X-rays?
A little bit.
A little bit.
He said there's nothing there to work, because I'd ask about cortisone or anything. He said it'd be like spraying WD-40 on the hood of a car with a blown engine. You done something, but nothing to help.
Nothing to help. It's probably a good analogy. So, what we're typically looking at, this is your left knee over here, we're looking at the amount of space between the two bones, and you can see you've got pretty good space all the way across. But, you do have arthritis in the left knee, so this is narrower than it should be, but there's still space. But you can see here on the inside part of this one, there's a pretty big difference between the two, and so it's pretty much bone on bone here on the inside part of the knee. Bone spurs around the outside part of the knee too, so there's arthritis all the way across, but bone on bone here. Let's see what that tubercle looks like. Yeah, so these are all these fragments here.
Yeah.
So that's what you're feeling there on the front part of the knee. So there are a lot of loose fragments that are in there. Now, a lot of that, like we talked about, the tendon comes there. So a lot of that some of it may be in the tendon itself. So
that's why it feels like a splinter.
The splinter feeling, I think, over here is because the two bones are grinding together. That's what's causing that. So when you feel that is when your bones are grinding. This knot here is because of these fragments. We could probably get most of them out, but there's a chance we may not be able to get all of them out when we're in there, especially if it's in the tendon.
Yeah, that does look like it's sitting real tight on each other.
Yeah, yep. So we'd have to get a look at that and see if we could get them out. My hope is we could get them out, but there's a chance we may not be able to. But
years back, in the young and dumb days, I actually put this kneecap over here.
Oh, geez.
And I put it back myself with a rubber mallet.
Is that right? Oh my gosh.
And it smarted for several days, but
yeah, but you never did anything about it. Just kind of went back at it.
Yeah, so I could go back to work. That was one of the evil necessities that I had to do.
Right.
I said, well, ain't nothing broke yet.
Right.
I guess I'm collecting the interest on the dumb things that I invested in my earlier years.
Right, exactly. Yep, so, obviously once it gets to that point, if you said, okay, what can we do to fix it? Knee replacement would be the only option to fix it long term. But hopefully would do well for you. Obviously take the bone from rubbing together, remove all the bone spurs that are there. Hopefully we'll be able to get all those fragments cleaned out that they are in the front.
That's what all that is.
That's what all that is, yep.
Okay.
And so recovery, the way that I do my knee replacements is a little bit different than most people, and so we come from the inside part of the knee, so we avoid cutting into the muscle and tendon, so that does help make the recovery quicker, and then usually less pain as well because you're not cutting into that tendon. Still a knee replacement, but comparatively the recovery is much better.
So you don't come up the front of the knee anymore?
No, so that's the way, that's the way that I typically did it in the past, and that when you come down the center, that's when you have to cut into the tendon and muscle, and that's what makes the difference. And so our incision more comes to the inside, so it's more over here, and so we avoid cutting into that muscle and tendon, and that's what helps make the recovery better.
That's a new procedure?
New procedure, yeah. I've been doing it for about 2 years now. So.
Okay, because that's been about how long you've had yours done. So.
Yeah, March will be 2 years.
Yeah, so it must have been right before.
March was 2 years.
Yeah, it must have been right before when we did that. So.
Okay, so that's less downtime.
Less downtime, that's right.
When are you looking, when's the availability?
Right now I think we're booking, unfortunately, like 6 months.
Okay.
So it'd be the first of the year.
Okay, well, that will work out okay because I can't be down in October. I got a wedding that I got to officiate, and I told her I ain't doing anything to interfere with your date.
Gotcha. Now, you're 5'7"?
Correct.
And then how much do you weigh?
310.
Okay. So the only thing is the hospital just passed a new regulation for like weight limit. And so BMI, you have to be a BMI of 45 or under. Okay,
So how many pounds would that be?
so you're at 48.5 currently, so not that far, but let's see what it would be if we could go. All right, so you're at 310. You'd have to get to 285, so 25 pounds. So that's not
undoable.
Undoable for sure, and that gets you under their limit. So we could go. I mean, because it is so long, we could go ahead and schedule it.
Okay.
Just know if for some reason we didn't lose it, I mean, they'll cancel it.
Yeah.
That's nothing to do with me. I'd gladly do it because, and that's what I tell people, you know, people carry their weight differently. You know, a lot of times it's in the belly. The knee's pretty reasonable. I mean, there are people with higher BMIs or lower BMIs, I'm sorry, whose knee is way more padded than what yours is. And so, you know, they should take that into consideration versus just putting a blanket number. So I kind of disagree with that to some degree. But I think, you know, 25 pounds, we should be able to get there. Now, you know, if you said, well, I can do it on my own, that's great. You know, we also, you know, offer through the med spa across the street, like the semaglutide, the Ozempic, those type of things. And so if you feel like you need help, just let me know, because we can always get those, and we can get them a lot cheaper than, say, you can get them at the pharmacy and things like that. So
what medical clearance, I know it's too early to do it right now, what medical clearance would I have to be looking at?
Yep, so your primary care doctor, and my scheduler would help get all that coordinated, so you wouldn't have to do it on your own. She'll help you.
Okay.
But the primary care doctor would be one. A dental clearance is another one we have to do. And then do you see a cardiologist?
Yes, I actually see her tomorrow.
Oh, perfect. Yeah, so you could go ahead and let her know that, that you got that coming up, but we would need the cardiologist clearance. Any other specialists?
Urologist.
Urologist, yeah, shouldn't be a problem there. So it'd mainly be the primary care doctor, the cardiologist, and the dentist.
Okay.
Those would be the three.
That won't be any problems.
Yep.
Then. So I guess go ahead and start lining
it up.
And we'll see what we got to do from there.
Okay.
And I guess she can call me and let me know what we got to do, or.
Yes, yeah, she'll go over everything with you. Go ahead and find you a date, and then she'll help get all that coordinated.
Okay.
Sound good?
That sounds good to me.
All right. Well, come on up this way, and we'll go talk to her, okay?
At least I know what's happening.
That's right, that's right.
And why it's wanting to be in backwards.